little thing. If you catch it, what it does is it promotes and prolongs the growth phase of the hair cycle, slowing the progression of hairs. So it acts directly to enlarge the miniaturized hair, and it makes it thicker. So what it does is it keeps the hair in the scalp longer, and it makes it thicker. And in women, this can be significant. In men, if they've lost a lot of hair, there's nothing to do. But if they're early on, and in women, if it's early on, just adding a little bit of thickness to the hair and keeping it in the hair longer can be an important factor in keeping the hair longer. And these are some of the studies. And not everybody, of course, responds this way. But you can see patient A that had, this is at baseline, a little bit of thinning there, and at 16 weeks and at 48 weeks, this is a very, very nice response to the hair loss. And you can see here, this is patient B. See how thin she was, that Christmas tree pattern we talked about, at 16 weeks and at 48 weeks. So these are some good responders. Here's 5%, this is the 5% solution in men, and we can see the picture here at baseline and at 48 weeks with significant regrowth, and they called it moderate. And patient B, when the study was done, they had dense regrowth at baseline, at 16 weeks, at 48 weeks, and look at this patient, patient C, at baseline, at 16 weeks, 48 weeks. So these are very, very good responders. Now, finasteride is an interesting drug, and this came on the market a couple of years ago, and they're evaluating a lot of other drugs that can do the same thing. And basically what they do, we talked about testosterone, there's an enzyme that's called 5-alpha reductase, and this enzyme converts your testosterone to hydrotestosterone. This drug blocks the conversion because we talked about that the bad one was dihydrotestosterone. So what it does, it blocks the conversion, so you have a lot more testosterone, which is the good one, and you have less of the bad one, which is dihydrotestosterone. So that's how this drug works. Now let's look at some of the responses. This was 26% of patients were rated as slightly improved, and you can see the response here at 1 year and at 3 years. This I would call very good, right? This is another 30% of patients at 3 years, and you can see the improvement at 1 year and at 3 years. And here's another percent, and another group of patients that had significantly, they call them greatly improved, with the finasteride at 1 year and at 3 years. And this is very good. So these are, and not everybody will respond as good, but if you catch the patient that's going to respond, you can really change their life. And I think the beauty of treating these patients is that they'll be able to keep their hair longer. These are the patients that have the androgenetic alopecia. So I think it's important to understand the pattern of hair loss, their severity, their gender, when to begin treatment, and patient education, which is important to have reasonable expectations and to adhere to your treatment. So I think this morning you've understand, and I hope you will now, when you go and see a doctor about this problem, you'll be a little bit more intelligent, because you will understand. You understand, the different types of hair that we have. You understand the hair cycle,